Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens. Join me, Dr. Tarryn, and health expert Emma as we explore delicate subjects related to the women's health space. We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin. Hi, everyone. I'm Dr. Tarryn Kawalsky, co-host and founder of the Ovarian Club podcast, along with Emma, my bestie, who's living her best life on holiday. And for today's episode, we're going to be doing something a little different. In light of the fact that she's on holiday, I have been given the liberty to do a standalone solo episode, and I am feeling so totally out of my comfort zone, guys. I can't even tell you. This is like the most awkward thing, speaking to myself in front of a camera. But anyways, I do miss her dearly, but somebody has to keep the show afloat, and I will take on this immense responsibility. And for today's topic, I thought, given that I have free reins to talk on whatever I like, and we can keep the prude Emma out of this, we're going to talk about lubrication, what our vaginas like, what our vaginas do not like, keeping a little bit edgy, but more taboo, deviating from our mainstream TAMO conversations. For those of you who have never tuned in before, the Ovarian Club is a women's health and wellness podcast grounded in evidence-based discussions, unpacking women's health and wellness topics through a scientific lens. And really, the purpose of today's episode is to shine lights on an important topic, and that is lubrication, which is often very much overlooked. We're going to be discussing what the pH of the vagina should be, the osmolality, what are compatible products for our vaginas, what our vaginas like to steer away from. And really, we're going to keep it simple. We're going to chat about silicone versus water-based versus oils. I know you guys have these questions because patients come to me a lot with these questions. And so I'm here for you. I've done the research. It's actually pretty straightforward. I really look forward to unpacking this with you all today in our episode. And I urge you all to come forward. If you've got any further questions, do send us your questions your way. So really, this all came about when I started reading a book called Vagina by Naomi Wolf. I think it was published back in 2012. And it's a very interesting book. It explores the relationship between the female body and mind. It delves into the physiology of the vagina, as well as its connection to female desire and fertility. So this is where the idea came to mind. Let's just talk about lubrication. And I really do hope that you all learn a lot from this episode, as much as I learned. So before we get into it, I wish to state a disclaimer. And that is, although I am a qualified medical doctor, this podcast does not serve to offer any personal medical advice. So always consult a health practitioner directly if you have any health concerns. And really, that's about it. We're going to keep it casual and we're going to get into it right away. So now that I've got your attention for the next 10, 15, 20 or so minutes, what is lubrication and what is a lubricant? Why do we use lubricants? Well, lubricants are indeed an intended substitute for a natural moisturizer in the vagina. And its aim is to decrease friction during penetrative intercourse, be it vaginally, anally, wherever. And well, this can serve as a purpose to make sex more fun, for couples to try something new, and also to make sex more comfortable. And really, the emphasis of this talk is more medically based. And yes, it's a fun and edgy topic, but it's also very serious. And that's because as a doctor working in women's health, I'm often confronted with patients who come in complaining of painful sex. There are so many medical conditions that can cause vaginal dryness down there. And yeah, it's a very important topic to unpack because vaginal dryness is a super common problem. Typically, one mainly encounters it towards perimenopause going into menopause. It's more of like a later sign of menopause, the genitourinary syndrome of menopause, previously referred to as vaginal atrophy, but we no longer use that term. Menopause is the most common reason accounting for this, as our estrogen levels decline as we enter into the menopause. But other common causes for vaginal dryness include yeast infections, or breastfeeding, hormonal fluctuations, and birth control that lacks the estrogen component. So this would include your progesterone-only injection shots or implants. Sometimes pelvic muscle spasming, tightness, which can be perceived more as friction. So endometriosis can cause more pain during sex, but sometimes that can also be perceived as dryness. So essentially what I'm getting at is that there are many medical conditions that cause vaginal dryness. So if you're listening to this and you're feeling that you need a lubricant that you've never needed before, and all of a sudden you feel like your ecosystem has switched from the Garden of Eden to dry desert, well, then it definitely is worth consulting a healthcare provider directly. So that's a bit of background. Now onto the more sciencey part of my talk. When looking at what constitutes a good lubricant, there are really two things to consider. The first one being the pH and the second one, the osmolality. So the pH of the lubricant must match the pH of the vagina. And as per the World Health Organization guidelines, that should be in a range between 3.5 to 4.9. So basically, the lower, the more acidic. So 3.5 is more acidic and 4.9 is more alkaline. So our vaginas are generally more acidic in nature. And so if you're encountering a lube that has a pH of 6, for example, I would suggest this is a little bit out the range and it's best to shift to another lube. So definitely look at the pH and make sure that it's compatible with that of the vagina. Then when we're looking at the osmolality simply means the concentration. So it's how concentrated the product is. So the vagina osmolality is between 285 and 295 millimoles per kilogram. And I know that sounds like Greek to you all, but basically, if the lube's osmolality is higher than that of the vaginal tissue, it essentially draws water out towards the lube. And then as a result, the vaginal tissue is more dry, can become dehydrated. And then this can also even increase the theoretical risk of sexually transmitted infections if exposed. And so when we look at the osmolality, again, similarly to the pH, the lower the better, with the ideal one being less than 380 millimoles per kilogram. In fact, the WHO guidelines, again, when it comes to osmolality, recommends against water-based lubricants that have an osmolality of greater than 1,200 millimoles per kilogram. I mean, that's way too high. So general rule, guidelines say keep the pH less than 4.5 and the osmolality less than 1,200. So definitely consider those. Then when it comes to the ingredients, what to avoid, there is a long list, and I'm not going to bore you all with the list, but I'll mention some of the main ones. So parabens. Parabens are essentially preservatives, and they extend the life of the lube. So in a way, yes, we do need preservatives to make sure that the lube stays alive and doesn't rot in your cupboard. But on the other hand, some preservatives are definitely superior to others. So I would really suggest avoiding parabens, because parabens as a preservative is a potent endocrine disruptor, which means that it almost mimics hormone actions. And basically, it could even wreak havoc in the body and just disrupt the whole vaginal microbiome. So I would avoid against the use of parabens. Then we've got glycerine. Glycerine are similarly preservatives that are mainly found in water-based lubricants. And I would recommend steering clear from these ones because they have a higher osmolality at baseline. And so an yeast can potentially use glycerine as its food source and then thrive and propagate. So definitely steer clear from glycerine, especially if you're predisposed to yeast infections. Other ingredients to avoid would include any numbing ingredients that have like anesthetic in it, like for example, benzocaine numbing ingredients. Definitely stay away from that. Don't let that touch your vagina. And similarly, chlorhexidine or strong antibacterials. You don't want to be douching and putting antibacterial products in your vagina because the vagina thrives off many bacteria, and these are good bacteria, and it's necessary for the vaginal microbiome. So you don't want to disrupt all the good bacteria that's keeping everything nice and healthy down there. So if you see chlorhexidine or any crazy antibacterial products, definitely keep it away from there, because our vaginas at the end of the day are self-lubricating organs that basically look after themselves, flush out things when it shouldn't be there most of the time. So you just want to leave it alone and keep everything as is. So then we've got petroleum jelly, Vaseline. Petroleum jelly is unfortunately not an ingredient that I would recommend, because the pH of the petroleum jelly and the pH of the vagina are not similar, and it can similarly lead to yeast infections and as well as bacterial vaginosis. So I would say just best give that one a pass. And then baby oils. Oil-based products in general, I wouldn't recommend because they tend to trap bacteria, disrupt the vaginal microbiome. They can increase the theoretical risk of vaginal infections that way. And not to mention, they could just be messy, hard to clean up. The oils don't tend to wash off easily. It may lead to lingering irritation. So not high up there on my list. And then the warming liquids or the tingling lubes, the active ingredient can be a higher concentration of the propylene glycol, alcohol, and this can definitely mimic that burning effect when it comes into contact with the vagina. Some of these can be more irritating than others. So I would just say steer clear from these, especially if it doesn't feel good or if things feel unnatural down there and you're not enjoying the feeling or it's causing irritation. Perhaps stay away from that one. Okay, then I often get asked, what constitutes a natural or organic lube? For me, that's marketing terms, because essentially all water-based lubricants will contain a preservative one way or another. And a preservative in and of itself is not a natural product. But I understand why it would be there, right? Because you need preservatives to keep things fresh and prevent bad bacterial overgrowth. So it's not to say that just because it's not natural and has preservatives, it's a bad product, but I just want to emphasize here that natural does not necessarily mean preservative free. So if that's something that you're specifically looking out for, don't fall into the marketing trap. Then we've got the types. So I've loosely alluded to some of them. We've got water-based, silicone, and oil. Those would be the three main categories, and each have their pros and cons. Let's go through them. So water-based, cheap, readily available. It's suitable for the use with condoms. It doesn't cause the condoms to degrade. The downside to the water-based products is that it does need constant reapplication, as it tends to evaporate quickly. So not ideal if you're wanting a long night of play. If you're using it for that specific reason, that is. Okay, then silicone. Silicone lubricants typically have the same basic ingredients, cyclomethicone and dimethicone. They last longer, so that is a huge advantage over the water-based. Tend to be a little bit more slippery. They can also be used with condoms, which is a huge plus. Some other factors to consider would be the use of silicone along with silicone-based sex toys if you're using lubes for that reason, because compatibility can be an issue and it can potentially degrade the silicone sex toy. So just follow the manufacturer's recommendations for lube choice. And then lastly, we've got olive oil, coconut oil. They can be used. I mean, it's a class of its own. There's so many different kinds of oils. The oils tend to last longer. They're also readily available, even in your kitchen cupboard. How convenient. But they cannot be used with latex condoms specifically. So just be aware of that. It will cause them to degrade, and then it just stains the sheets. It's messy. Okay, so the next question is, do you need a lubricant? So if you've got no issues at all, so in other words, there's great vaginal lubrication down there, no, you do not need a lubricant. And if you're especially wanting to optimize your fertility and sex is not painful, then I'd say, no, don't add anything there. There's no lubricant that can optimize fertility. I'll put it to you that way. Sometimes there are advertised as that, but there is no lube to boost your fertility. Okay. Now that I've got that out the way, remember another important factor to consider is that lubes are designed to match the pH of the vagina, or shall I say a good lube is designed to match the pH of the vagina. And the vagina tends towards acidity, as we stated earlier, with a slightly lower pH range. But then as a consequence, using a lube can impact sperm function, which tends towards more alkaline. So there is sometimes concern that you're using a lubricant that then inadvertently kills the sperm. So if you're wanting to optimize your fertility, the best case scenario would be to avoid a lube. But then having said that, there are some great lubes out there that take all these factors into consideration. And I would say of our three groups, water-based is definitely the most fertility friendly. So if your vagina feels dry, sex is painful, you're needing to have intercourse or wanting to have intercourse for the sake of fertility, then yes, a lubricant may be indicated. And I would say go for the water-based ones, certainly over the silicone and oil-based. But having said that, again, not all water-based lubricants are vagina-friendly. And an example of this would be KY jelly. There's multiple conflicting studies, but I'd say the consensus isn't really out yet, but it is thought that it could affect sperm motility and sperm survival because the pH and osmolality aren't optimal for sperm survival. So I would say just use it with caution. If you could avoid using that one, rather opt for another water-based product. The silicone-based lubes are generally not considered fertility friendly unless specifically marketed as sperm safe. So just watch out for that. And again, the oils tend to decrease sperm motility, and they can also trap bad bacteria and cause bad bacterial overgrowth. It's not to say avoid completely, but just be mindful of all of that. Okay, so it's been a great conversation, guys. I have spoken for far too long. I hope I've still managed to keep your attention. This was definitely an interesting experience. I miss Emma, and I hope you're having a fantastic time away on your holiday. And thank you all for tuning in. I personally learned a lot doing research for this episode. learning about lubricants was not did not form a basis of my medical training. But it's always about learning and evolving and growing, and just trying to help patients as best we can with the knowledge that we're learning. So yeah, it was such a pleasure chatting with you all today, and I hope to see you guys all again soon. Please feel free to reach out to us. You can send us a DM on Instagram at the Ovarian Club, or you could send us an email at theovarianclub@gmail.com. We are really there for you. We would love to address any questions that you have, so feel free to reach out and give us a shout. And that's it for now, folks. The Ovarian Club. Powering life, nurturing health, shaping sustainable wellness. We'll see you soon, follicle friends.